Hi everybody, my name is Advait and this video is about pelvic inflammatory disease. When you see a patient with abdominal pain, fever, vaginal discharge, the first thing you may think in mind is pelvic inflammatory disease. It's important to identify this because it can progress to sepsis and a patient may die. I'm going to let you know in this video how to diagnose and treat such a disease. So when the patient comes, what you want to do is a focused physical exam, and it includes abdominal, rectal, and genital exam in particular. And apart from these exams, you may also do general exam, head and neck exam, skin, cardiovascular, chest, and extremity exam. How you approach this case is once you do a focused physical exam, you'll get to know whether the patient has cervical motion tenderness, bilateral adnexal tenderness, and a mild purulent discharge at the cervical os. All these findings strongly support the diagnosis of pelvic inflammatory disease. You should start the patient empirically on antibiotics, and the criteria for inpatient management in these cases include a fever, severe abdominal pain, inability to take oral medications, pregnancy, and pelvic tubo-ovarian abscess. So first off, whenever the patient comes into the emergency, you want to get an IV line, you want to do a CBC, BMP, STD test like VDRL and HIV, blood culture. You also want to do a beta HCG test to rule out pregnancy. You should do a urine analysis, urine culture, cervical gram stain, cervical gonococcal culture, cervical chlamydia culture, and a pap smear. All of these orders should be placed as stat. So once you have the result on gram stain or culture, for example, you see a Neisseria in the gram stain result, you should transfer the patient to the ward and start the patient on antibiotics like cefotaxime, doxycycline, and if the patient has pain, you give them morphine, you give them Phenergan for nausea and vomiting, and you give acetaminophen for fever. You can also put the patient on NPO with bed rest and bathroom privileges. What you should do is you should monitor the patient uh, every few hours. You should repeat abdominal and genital examination, say every 12 to 24 hours to make sure the patient is getting better. And once you note sustained clinical improvement for 24 hours, you can switch to oral antibiotics and provide counseling to the patient. Counseling part includes treating partners, patient counseling, contraception counseling, medication compliance, safe sex counseling, and smoking cessation. In the outpatient setting, if you want to treat pelvic inflammatory disease, you should start the patient on ceftriaxone IM 1 dose plus doxycycline for 14 days. Or you could choose cefoxitin plus probenecid, and you could also add doxycycline for 14 days. Metronidazole may be added to inpatient or outpatient regimen where you suspect bacterial vaginosis, trichomonas, pelvic abscess, or recent gynecologic instrumentation. And you should follow up every patient after 72 hours to ensure improvement. Thanks for watching, guys. If you like my content, subscribe to this channel, and I'll see you in the next one.